the Oregon's Healthcare Market Oversight Program Public Input Session number 1. Next slide, please. I'll go over some meeting logistics, then an agenda. But starting off, I'd first like to remind us that this is a public meeting, so it is being recorded. After this meeting, the recording will be uploaded to the Oregon Health Authority's website. Closed captioning is available. A transcriber is also attending this meeting. He will produce a written transcript after the meeting. I request that you state your name before making a comment and speaking as clearly as possible and an even cadence to ensure an accurate transcription. And then third, please keep your microphone on mute until it's your time to speak to reduce outside noises. Next slide, please. As a reminder, you will need to sign up in order to provide input to HCMO during this listening session. The sign-up link is located in the chat. We will start with a brief overview of the HCMO program, hear public input for about 15 minutes, and then wrap up and provide next steps. Next slide, please. Through the Healthcare Market Oversight Program, which you will hear me refer to as HCMO, OSHA reviews proposed healthcare business deals to make sure they support statewide goals related to cost, equity, access, and quality. Through this, we aim to promote transparency, support statewide priorities, and monitor and study impact. So we publicly post notices and reports so that communities have information about planned transactions. The HCMO program ensures that healthcare deals support statewide goals related to affordable care and eliminating inequity. And then finally, HCMO tracks deals in Oregon and evaluates how they may affect people. In the upcoming year, OSHA will produce reports on the impact of healthcare consolidation in Oregon. Next slide, please. For each proposed deal that is reviewable, OSHA may approve the conditions, or disapprove. For deals that involve a domestic health insurer, OSHA provides a recommendation to the Division of Consumer and Business Services, also known as DCBS, who make the final decision. Next slide, please. So we're going to provide a very high level of the HCMO review process. So first, healthcare entities will file a notice that they are planning a transaction. If the transaction is reviewable, the HCMO program reviews the transaction and its potential impact. At the same time, the program invites public comment and may engage other experts. HCMO will then issue a decision, and then if the transaction is approved or approved with condition, the program conducts follow-up reviews 1, 2, and 5 years after closing. I do want to note that this is only specific to notices of material change transaction. The process for emergency exemption is different from what's on the screen. Next slide, please. So during reviews, HCMO looks at how a proposed transaction could affect healthcare cost, quality of care, market consolidation, access to care, and health equity. Next slide, please. The HCMO program is guided by the Oregon Revised Statute, Oregon Administrative Rules, and other frameworks such as our Guiding Principles Framework and sub-regulatory guidance. Today, we're seeking feedback to inform the administrative rules and guiding principles and framework, but we may hear feedback that relates to statute and sub-regulatory guidance, such as program operation. We'll take all feedback into account accordingly. Next slide, please. In order to provide public input, you will need to sign up through the link found in the Zoom chat. We will post a rolling list of those who signed up. When I call your name, please unmute and state your name, organization, or affiliation, and share your ideas for changes to our rules or guiding principle. Each person has a tentative 3 minutes to speak, pending the number of people who sign up. There may be time to provide additional comment at the end, pending our sign-up list. If you are unable to provide verbal input today, we will share additional ways to let us know your thoughts. Next slide, please. OSHA's role during the public input session is that OSHA staff will actively listen to public input and not respond. OSHA staff will compile public input received today and consider input when reviewing HCMO rules and guiding principles. A recording of the listening session will be posted to our HCMO website. At this time, we're going to move into public input. And we will pull up a timer. I'm going to enter the current sign-up list so folks will know which order they are in. Thank you, Emma. And first up, we're going to have Tom Sinkic, followed by Dr. Michael Huntington, and then Lori Hoagland. And with this, I believe we can increase our time to 5 minutes. That will it. And then Tom Sinkic, we'll start with you. If you could come off mute and share your thought. Okay. I'm not seeing Tom on at this time, so we'll move to Michael Huntington and then come back to Tom if they do arrive. Michael, if you're here, can you please unmute and share your thought?
Yes, can you hear me?
Yes, I can. Thank you.
Well, good. Well, thank you for serving on this committee and hearing my testimony. I'm Michael Huntington, a retired radiation oncologist from Corvallis. My community has been deeply affected by an unjust corporate buyout of our long-term respected healthcare clinic here. The current emergency exemption in the OAR is so broad that clinics or hospitals facing financial trouble can easily argue urgent acquisition is needed, bypassing public review, transparency, and accountability. The Corvallis Clinic sale to Optum United Health Group in 2004 illustrates the harm. After the buyout, many physicians left, service levels declined, and potentially thousands of patients lost access. Outcomes the exemption process is supposed to prevent. Similar disruption occurred at the Oregon Medical Group in Eugene after its Optum acquisition in 2021, with abrupt loss of provider access for patients. The rule's emergency criteria are vague and exploitable. Quote, immediately threatens, close quotes, or quotes, urgently needed to protect solvency, close quotes, allowing distressed entities to justify exemptions regardless of broader community impact. The process can bypass public comment and effective review, leaving communities powerless and lacks requirements or enforceable commitments about provider retention or service continuity. We urge leaders to strengthen the rule by, number one, precisely defining emergency with specific financial metrics and requiring documented efforts at local remedies first. Two, mandating disclosure of transaction details, even in emergencies. Three, guaranteeing every exemption has a 3-month public comment period. Four, requiring retrospective review of patient access and provider retention within a year after the deal. And five, involving counties, advocacy groups, and workforce representatives in the evaluations. Closing these loopholes is urgent to protect communities from the unintended consequences of unregulated healthcare buyouts. And thank you.
Thank you, Dr. Huntington. Next, we have Lori Hoagland. Hello, the listening session is still in progress. We have 10 minutes remaining for verbal input. If you'd like to provide feedback for the HCMO program during this meeting, please sign up using the link located in the Zoom chat. Once your name is stated, come off mute and provide your name, organization, and comment. OHA staff will actively listen to public input and not respond. As a reminder, this meeting is being recorded. A recording of the listening session will be posted to the HCMO website. Lori, I see that you were able to join us. If you would like to come off mute and provide your comment, we are giving folks about 5 minutes for public comment at this time.
I can unmute. I can't undo the video, but I can unmute. Thank you for letting me provide public comment. I think that this board is extremely important in the state of Oregon. I've appreciated being able to provide comments. I appreciate the criteria that you are looking at business mergers, acquisitions with. I'm a healthcare provider, nurse practitioner, taking care of patients in Oregon. And I provided input with the Kroger Albertson um, business deal as well as with the Care Oregon business deal. And my one concern is with the Carvalis Clinic, which was given an exemption, that the timing can create a possibility of making companies exempt. And I think there's been many difficulties that have come out of Optum's acquisition of that clinic. And I think it would have been a good idea for it also to be scrutinized with the same criteria as other mergers have been. And that's the feedback I wanted to provide today, is just keep it up. I think it's really important that you have public feedback and that you are looking at business dealings with healthcare in our state this way. And my only concern is really to be able to make sure all of them are given the same uh, process of review. Thank you.
Oh, sorry, so I got muted. If you'd like to provide public input, we do have a link in the chat as well. We will remain on the line. We do not have any additional content coming. We do have the link to the PowerPoint slides in the chat, and the recording will be posted on our website. Thank you. Hello, the listening session is still in progress. We have 5 minutes remaining for verbal input. If you'd like to provide feedback for the HICMO program during this meeting, please sign up using the link located in the Zoom chat. Once your name is stated, come off mute and provide your name, organization, and comment. OHA staff will actively listen to public input and not respond. As a reminder, this meeting is being recorded. A recording of this listening session will be posted to the HICMO website. Thank you. I apologize. We actually have 5 minutes left of the meeting. My timing was off a little bit. I'm sorry. With that, can we go back to the PowerPoint slide so we can go over wrap up and next steps? Perfect. Thank you. All right, next slide, please. So our tentative timeline is that we are hosting more public input sessions in September. On September 30th, OHPB announced a special meeting to approve any edit to the HCMO guiding principles document. We do have our RAC applications open right now through October 10th, 2025. If this timeline continues on time, we will host the RAC meetings in November 2025 with a potential rules hearing in February 2026, and that will also include the last date for public comment. If this also means that the rules effective date will be April 2026. All dates are tentative and may change. Next slide, please. There are additional ways to provide input. So you can provide input through informed HICMA rulemaking and guiding principles by sending us an email, submitting a comment via the public comment form, leaving a voicemail at 503-945-6161. All comments will be posted to the HICMA webpage. Next slide, please. As I mentioned, we are hosting a second listening session next Thursday from 12 p.m. to 1 p.m. I've included the Zoom link and additional website information in the chat. If you'd like to apply to be a RAC member, please do so by 3 p.m. on Friday, October 10th, 2025. Included at the application link on our website, you can find more information, including what does it mean to serve as a RAC member. And we are requesting one representative per organization. Next slide, please. Thank you again for being here today to listen as people provide feedback. For more information, we include the link to our HICMA website, HICMA rules, and you can always send us an email at hicmo.info@osha.oregon.gov. Thank you. Bye.